guys, my name is Amish Tripathi and I'm the director of the Nehru Center. The Nehru Center is the cultural wing of the Indian High Commission in the UK, and we've been in existence for many decades, and we organize wonderful events at this very auditorium, which is in Mayfair in central London. Sadly, as you can see, the auditorium is empty. It has been empty since we were all put into lockdown due to the coronavirus pandemic. But what we Indians believe is that the other side of a crisis is an opportunity. And what we have done at the Nehru Center is moved all our events online. So now if you attend our online events, every single seat is a VIP seat. Like you get a front row at our events. No trouble of parking, no trouble of traveling all the way. And practically all the programs that we would do, like literary discussions and dance performances, musical performances, we are doing them all on our online channels. You can register for our newsletter at our website nehrucenter.org.uk. You don't need to write them down, they will be displayed at the bottom of the screen. You can also come to our Facebook page, which is a verified page, the Nehru Center. You can follow updates on all our events on Twitter as well, the Nehru Center, that's also a verified account. Or you can come to our YouTube channel, again, the Nehru Center. We are nothing if not consistent. I hope you do come to our online channels and enjoy the events that we are putting up for you. Thank you so much for all your love and support. Namaste, Jai Hind.
Namaste, Assalamu alaikum, and a big hello to everybody who is joining us today on this very crucial Nehru Center program. Before we begin, let's spend a moment, make space for every life that we have lost due to COVID or any other illness around the world. We at Nehru Center are aware that these are challenging times for the entire world, and we send our thoughts and prayers to every family that is affected. Our thoughts are with you. That's the reason why we wanted our platform to resume our events with something that would help you tide over these times. Knowledge is power. Hence today we have one of UK's most respected innovators and physicians par excellence as our guest. He heads a team of 700 doctors under BAPIO that are helping not just the UK, but India during this tumultuous time. But before I welcome our guest of honor, I would like you all to help me welcome our visionary director at Nehru Center who makes these amazing events possible. Amish Tripathi is a diplomat, author, and columnist. Amish has been listed amongst the 50 most powerful Indians by India Today and has written 10 books till date. His latest, Sohail Dev and Dharma, a favorite of mine, with Bhavna Roy, are trailblazers. Let's welcome our director, Amish Tripathi.
Thank you. Thank you so much for having me here, Ageshwari.
It's always wonderful to see our director. Amish, this is also a personal journey for you because you've just recovered from COVID and you're still doing poorly, but still waiting for, energy and exuberance to re-enter your life.
Yeah, so I had gone to India mid-March for what was to be a 2-week holiday to meet my son for his birthday, and I was stuck there for 6 weeks. When I'd gone, the situation wasn't that bad in Mumbai, but then within a week of me landing up, it kind of just went through my entire family, and all of us have recovered, but it's still debilitating. Even a slight, as the doctor who was treating us told me that you have no risk of getting COVID, but yet you're at risk of other infections. Your immunity is weak. So in fact, which is why I thought this program with Professor Parag would be so useful for all of us, because as you said rightly, knowledge is power. What we can do to help ourselves as much as possible through this disease is useful information.
Thank you. Thank you for picking such a crucial, important topic. With your permission, may we welcome our guest.
Please.
So, ladies and gentlemen, let's welcome Professor Dr. Parag Singhal. He's a consultant endocrinologist, National Secretary of BAPIO UK, Executive Director of BAPIO Training Academy. He's the chair of Indo-UK training programs. He's the Honorable Visiting Professor of the University of South Wales. He's the Honorable Professor at the Bolton University, also visiting professor to Indian universities and the founder director of an independent think tank. Let's welcome Professor Dr. Parag Singhal.
Thank you, Rageshwari. Thank you, Amishji. So nice to be here.
Before Rageshwari ji carries on with the conversation, Professor Parag, if I might ask you one question, because when we were talking, as you said rightly, diabetes is completely a lifestyle disease. It's completely in our hands, and cancer, nothing is in our hands, and you just get it. What do you do? It's just bad luck. But COVID is, I guess, somewhere in the middle. Some things it's not in our hands, but some things that we can do, which can, help us, like taking care of our own health, for example. If we are fit, if we are not overweight, if we are not diabetic, then we can handle COVID if it hits us. So if you can kind of take us through that, because like even in my case, I've recovered from COVID, but I realized I got a slight infection yesterday morning, even though it's been some 3-4 weeks since COVID, and then suddenly like I find myself so much weaker in just a day or two. What can we do? What is in our own hands before we turn to the doctors? If I could ask you this.
Thank you, Amishi. It's a very, very good question, because there are a lot of things we can do, or put it this way, in our control. Certainly, we can take precautions to prevent ourselves from getting infected. That's the first thing. Whether it is social distancing, whether it is hand sanitizing, whether it is masks and wearing the mask properly. But still, the new strain which has come is highly infectious, highly contagious. So it is conceivable that despite all the precautions you are taking, you may still get the infection. So that is where our lifestyle comes in handy, that if we are leading a healthy lifestyle, if we have enough reserves in the body, and even if we have diabetes, if we control it well, maintain all the sugars in normal range, then we minimize the chances of severe disease. Essentially, the healthy lifestyle is boosting your immunity, allowing your body to respond in a proper way to any infection, be it viral infection, in this case COVID, or bacterial infection when we get some lung infections. So I think those are the two things which we can do, and everybody has to do during these unprecedented and difficult times, especially when we know that COVID disease doesn't have any specific treatment. Yes, there are some things which we can try, like steroids, but I think that largely it's our choice how we want to leave it and how we want to prevent it, how we want to reduce the severity. So I think what you're saying is this is so true. Knowledge is power. And I think this is the message which we need to send to masses, that lot of it can be done at our end without even touching a doctor. And that is how we can reduce the pressure on the hospitals.
Wow.
If I may leave it to you.
Yes. Thank you. Thank you for the question, Amishji. And I'm sure that everybody globally joins me in wishing our director a swift recovery. So,
Indeed.
Indeed. Thank you. Thank you to Amishji, who's going to rest because he's working through his illness and working through his recovery. So here's wishing him a swift recovery, and over to Professor Parag. Thank you so much for your time. Right away, we would love to know, about BAPIO and your role, because, it's amazing the kind of work BAPIO is doing where India is concerned. So please tell us
thank you,
everything about it.
First of all, it's an honor to be here talking to you. So BAPIO is British Association of Physicians of Indian origin, and it was founded by our current president, who is the founder president, Dr. Ramesh Mehta, some 25 years ago. So it has come a long way. And what started as a living room exercise, a group of few individuals and friends, has now become an organization of strength, a brand name across this country.
Yes.
And it is the largest organization representing doctors of Indian origin.
Of Indian heritage.
Yes. And there are actually some 65,000 doctors of Indian origin working in the UK. So it is a voice for all those doctors. And under the leadership of Dr. Mehta, we have come strength to strength. And it is a very influential organization working not only with regulators, different organizations within the NHS, but also trying to stand up to rights of doctors and trying to protect the patients and promote professional excellence.
That's amazing. And how is BAPIO at this point helping India? Because, I've seen just amazing media coverage, how BAPIO is helping doctors and patients in India. If you could let us know about that. And of course, and then we'll see Dr. Mehta's video as well. But we'd love to know, your route and the consultation, the virtual consultations that you have where India is concerned.
Oh, thank you. So yeah, as soon as the pandemic started, BAPIO officers met and Dr. Mehta was very keen that we offer some support. So we started thinking of three fronts. So essentially, first front is we are providing equipment to India in terms of ventilators, pulse oximeters, and oxygen concentrators during those times when oxygen was a problem in India. So that was one aspect we were trying to do. The second aspect, obviously, was providing support to people who need food through Akshaya and other organizations.
Okay.
So a lot of poor people were getting food from us. So it was a proper fundraising program by BAPIO, and whole of BAPIO got involved in during this endeavor. But the third, which is quite important and which came very handy for India, was telemedicine project. And the telemedicine project was all around creating manpower virtually in India, because India was expanding its number of beds. The doctors were stretched, they were rushed off their feet, and they were feeling the pressure. And what we wanted to do through telemedicine was to give them helping hand to our Indian colleagues. So we were conscious that this is the time when we can take over care of some patients, give them advice. And it was not expertise that we were providing. Indian doctors are pretty expert, but it was more of a support and help, manpower.
And probably also exchange of ideas.
Absolutely, absolutely. We both were learning from that exercise. UK, India. We wanted to know the pattern of the virus in India, how the new strain is behaving, and what are the different treatment options Indian doctors are pursuing. So it also gave us an insights into the practice of India. So I think that's how it became a very useful exercise. And telemedicine itself, we were providing on three fronts. One was radiology, because a lot of people were getting scans, but because of the immense demand, there was a problem in getting scans reported. So, of course, our radiology colleagues were able to do that. The second bit was around virtual ward rounds. And as I just said, there were COVID centers coming up. But those COVID centers needed senior doctors to look after those patients. So our team, our consultant colleagues offered that help. And that actually started gaining a lot of traction, and a lot of hospitals started getting associated with us for that.
That's amazing. We want to, of course, get to know about telemedicine in depth, but let's have a look at this video by Dr. Mehta.
The second wave of COVID infection in India caused unparalleled disaster situation. The news was heart-wrenching for thousands of doctors and nurses working in NHS in the UK. BAPIO as an organization immediately got our team together, and we planned a three-pronged strategy. The first one was to acquire oxygen supplying equipment as soon as possible. So far, we have already sent 130 non-invasive ventilators. We have sent more than 300 oxygen concentrators, 5,000 pulse oximeters, and several other bits like masks and gloves. We also have sent some medications like paracetamol to be used commonly for these patients. The second prong of the strategy was to provide food supplies to the daily wage earners who, of course, were finding it difficult to survive. We have already sent 40,000 pounds to several charities, including Akshaya Patra, who are used to supplying food parcels to these people. The third prong of our strategy is to provide telemedicine assistance, which Professor Parag Singhal is going to describe. We know that the COVID situation in India is going to continue for a long time. The impact of COVID could be not only financial effect on people, but health-wise, it is likely to cause other complications like the fungal infections which are already prevalent and long COVID. Friends, we will continue to support India on long-time basis as an organization. Thank you.
Thank you so much, Dr. Mehta. That was truly inspiring. Professor Parag, what can India and other countries do to overcome this current challenge, which sort of, we're far from it being over? We have lockdowns, we lift lockdowns, people then just get relaxed again. So what is it that countries are missing, what we can do to overcome this?
Yeah, I think we are living in a new world now. And this is probably going to be new normal.
A new reality.
New reality, lockdowns, intermittent lockdowns, and so on and so forth. And I think if we talk about the current crisis, what India is already doing is trying to reduce the pressure on hospitals by having those lockdowns. But I think what we need to do, and this is where the collective effort is needed of population, that everybody has to observe some COVID-appropriate behavior, public, because that is where the infection spreads. So whether it is social distancing, whether it is masks, and I think this is something which needs to be made mandatory for any country facing the pandemic. And that's probably not going to disappear for some time, even after vaccination. But the other thing we need to consider doing is people need to think healthy lifestyle, because that is something which is very, very important, that just in case, if you get the infection, you minimize the impact or minimize the severity of the infection. So that is certainly useful. And that is where the role of vitamin D and other stuff, which can be very useful and something which is easy to take. We'll talk about it in detail. But the third thing, the key challenge and the key to success here is vaccination. We have to ramp up the vaccination here. Vaccination is the only way to get on top of this pandemic, whether in India or other countries. And the reason for that is, this is not a countrywide problem. This is a global problem.
Global problem.
It is not going to be limited to one country. It can travel. So vaccination is something which not only now shows that it can reduce the chances of you getting infection, that means preventing spread of infection, and certainly it reduces the severity of the infection as well. And the good news here is that the UK study has shown that both jabs, Pfizer as well as AstraZeneca, are effective against Indian strain. So that's very welcome news. And the US study confirms that it actually prevents you from getting or minimizes your chances of getting infection. And if we don't get infection, we don't spread the infection. So vaccine is now going to serve both the purposes. Of course, we are waiting for more data to come, but that will emerge as days go by.
That's amazing. That is promising. I definitely want to talk about long COVID. It's affecting us personally. You just had a look at our director. He recovered. Amish has recovered from COVID, but he has long COVID where he's just consistently, doing poorly and attracting other infections. So what would you tell people who've recovered from COVID but are battling this severe weakness?
I think this is something which is observed in most viral infections. If you get a severe flu, simple flu can leave you debilitated. So it can happen with a lot of viral infections. And COVID obviously is much serious infection compared to other infections. So the weakness is inevitable, and that's going to take time. But there are certain things we can do to hasten our recovery, which is continuing regular exercises, graded exercises, not pushing the body too much, but gentle, continuing with some physical exercise, eating healthy stuff. Again, that helps in building our immunity. And that is so important because during the post-COVID period, recovery period, your immunity is low. and you are susceptible to get more infections. So the idea is to prevent more infections settling in. And of course, the third thing is having adequate sleep. And I think this is mindfulness, and nobody knows better than you about mindfulness. So this is something I'm sure you will be able to explain to our viewers, how mindfulness can allow good rest, mental rest, as well as physical rest.
I also feel, Professor Parag, it's such a unique and bizarre illness because, it's linked with isolation. So it affects your mind to a great degree. And when people say that, we have weakness in breathing, is it because the lungs have sort of lost its memory to breathe well? And then you need to, sort of remind your lungs again that, your capacity to breathe well needs to be increased. So pranayama, would be a great choice for people who are suffering from long COVID, isn't it?
Absolutely, absolutely. And I think post-COVID, people do take breathing exercises like spirometry, balloon exercises.
Yes.
And that's primarily because to increase your reserve of the lung, because COVID affects your lung. So there is every possibility that there is some scarring of fibrous tissue settling in. So effectively, you have to start from scratch and build your reserve. So that is where breathing exercises, pranayam, yoga, and all those things come in place. So I think those are all very, very crucial things in making recovery happen quickly.
Lovely. Do clarify the difference between an asymptomatic patient to a pre-symptomatic patient. And are asymptomatic patients less contagious? First, let's just talk about the difference, because it's sort of, with so much information overload, we want to make sure that we know the difference between these two.
Yeah. And I think there are a lot of patients who do contract the virus, but don't exhibit any symptoms. So not even temperature, not even kind of a common cold. They're completely, walking, talking, and absolutely normal. But equally, with the same infection, somebody can have quite severe infection, or somebody can just have mild infection, which is temperature, a little bit of cough, sore throat, and so on and so forth, whatever the flu can cause. Now, asymptomatic patients are equally infectious. And they can spread the infection as much as anybody else can do. And in fact, the percentage of asymptomatic patients is huge. 1 in 3 patients are asymptomatic. Therefore, once again, it emphasizes the importance of social distancing and wearing masks. Although the patient may be asymptomatic, but we don't know whether the person is carrying the virus or is infected with COVID. So this is where all track and tracing, testing and tracing, COVID behavior, staying away, open meeting outdoors rather than indoors, they all come in handy just to protect ourselves.
So it's really important to wear the mask. I know that it's mandatory in India, but it's not mandatory to wear a mask in the UK unless you're indoors, grocery shopping, or probably going into a store. Because whenever I'm outside, I'm always wearing a mask, and it sort of is humorous to many people that I would do that. But I think it's just so important that, yes, I could have great immunity, but I could be meeting someone else, and I could be an asymptomatic COVID carrier, and I could be infecting someone else. So through this program, we're requesting everybody to wear the mask. Is there a difference between wearing one mask and two? They're saying, double masking is the need of the hour.
Double masking does offer additional protection, but even if we wear single mask properly, that's good enough. And certainly in the outdoor setting, the chances of getting infection are low because of air, the virus doesn't circulate. But certainly indoors, we need to wear a mask. I agree with you. If we can wear mask even in the outdoor setting, there's no harm. It provides added benefit to us. But most important thing is, even in outdoor setting, we need to maintain social distancing. That's the key, so that we don't get that infection, because it's an airborne infection. So that is where it is very important to keep away from people.
So the lockdown, of course, has eased in the UK and in different parts of India or globally. We have a global audience here at Nehru Center. What would you tell people who are planning parties, who are saying, okay, now I'm allowed to, meet a lot of people, go out for dinners to restaurants? What would you tell people who are planning get-togethers?
I think it's a very difficult, because people have been in lockdown for months and months, and everybody is rearing to go out and have parties, meet people, hug people. Yes, and I think I can understand their enthusiasm.
Yeah.
And although UK has done very well with vaccination, 90% of the population has received first dose. So that's really good news. But till such time that the whole population is vaccinated, and even after that, but till such time that whole population is vaccinated, we cannot let our guards down. We have to maintain what is required was during lockdown period, masks, social distancing, and meeting and having parties outdoor as much as possible rather than indoors. And I think this is something which, it is if you look, virus is generally replicating or its peak in India during summertime when windows are closed,
Oh,
and in
really?
UK
Yeah.
during winter time when windows are closed. So I think we need to have circulation of air, whether it is our house, whether it is restaurants, and the best is to meet outdoors. That's the best thing.
So interesting. So it's almost like families or individuals need to take this responsibility individually so that we can support one another. Thank
Yeah.
you for that. Let's talk about vitamin D, because that's so intriguing that it's a vitamin that's most ignored, because everybody talks about immunity and then they tell you vitamin C and zinc, while you have been campaigning the cause where vitamin D is concerned and the connect, between the patients. I would love to know more about vitamin D so that, all our viewers can benefit from that information.
Thank you. Yes, we have talked about it. So, vitamin D is not just a vitamin, it is also a hormone. It is responsible for our bone health. But for centuries, for years, people have recognized its effect on immune system. So it has both anti-inflammatory and immunoregulatory properties. So it does regulate our immune system. And I think this is well recognized. What it does is it enhances the function of T cells and macrophages, which fight infection, be it viral or be it bacterial infection. So it is useful in any infection setting. And the low levels of vitamin D make you susceptible to get infections, different infections, generally more viral infections. So that's a theoretical aspect. Now, what is the scientific data? So scientific data suggests that vitamin D replacement does prevent influenza infections or reduce influenza infections. So that's the influenza. Now, do we have any evidence as far as COVID is concerned? So as of yet, there are no randomized controlled trials, which is a gold standard evidence in medicine, that vitamin D replacement, normal levels, or even vitamin D therapy would help in COVID. That said, there are plenty of observational studies for the last year, many studies across the world, which have suggested that low levels of vitamin D were associated with severe disease. Severe disease means requiring higher oxygen levels or even going to intensive care. Now, these are observational studies, and observational studies in the time of pandemic become important. They assume big importance. And randomized controlled trials are difficult to do or difficult to perform during pandemic when everybody is trying to save or do something to save life. So this is the general relationship of vitamin D with COVID. Now, generally across the world, wherever you are living in, whosoever you are, unless you are on vitamin D replacement, the chances are of having vitamin D deficiency are very high, particularly more so in people who have got colored skin, which we call, Black, Asian, minority, ethnic population, whether it Caribbean, us, or whatever. And that's because of a skin color. The pigment in the skin doesn't allow sunlight to be absorbed and be converted into vitamin D.
How interesting.
Yeah, and sunlight is the biggest source for vitamin D. It is not food. It is not your dietary pattern. It is not milk, or people assume that, we are having milk twice a day or thrice a day, cheese, and that will be. No, it is a sunlight. So imagine if sunlight is not being converted because of dark color, then clearly the chances are that we'll end up having vitamin D deficiency. To add to that, a couple of other factors, which is that we don't go out in the sun enough these days compared to 40 years ago when everybody was walking.
Yeah.
We wear protective clothing all the time. And third, in India setting, there is pollution. So the sunlight is not very strong anything. So because of that, the studies have shown that 90% of so-called ethnic population will have vitamin D deficiency. So here we are dealing with a public health problem of vitamin D deficiency, which possibly has some role with COVID. So I pose a very simple question to patients and to everyone. Is it likely that you have vitamin D deficiency? Yes. Let's check it if you can check it. But the key thing is, can vitamin D replacement provide benefit to COVID patients? Answer is very likely. Is vitamin D replacement ideal? Answer is definitely yes, because it is also important for your bone health. So we need to maintain normal bones. Third is it harmful? Giving vitamin D in the doses, is it harmful? Answer is no. Is it cost effective? It is cost effective. So the doses up to 4,000 units a day are absolutely safe dose. So as long as you take that dose, maintain normal level, it's a very what you call a cost effective way of dealing with the problem, which may have wider ramifications and potential benefits to whole of the body, not only to immunity but to larger, whether it is linked with dementia, linked with insulin resistance. And so many studies are coming out with role of vitamin D and linking vitamin D to different organ systems. So that is why a lot of attention is being paid to vitamin E, and that is why myself and BAPIO, we started a campaign advising our members and the public to take vitamin D.
Yeah, and I was very, very lucky, to be involved in that, because I was surprised that, I was vitamin D deficient, and it just completely changed my energy levels. So you're saying ethnic minorities, either you could be living in Europe or in sunny places, you could be vitamin D deficient, and we could take how much? What's the dosage?
4,000 units a day are safe.
Okay.
So any dose between 2,000 units to 4,000 units is absolutely fine dose. Anything less than that is not enough.
And what about children?
Yeah, their dose needs to be brought down according to their age, depending on what age they are. Yeah, pediatric doses.
Okay, lovely. So I'm sure that's going to help a whole lot of people. Professor Parag, what are the things to focus on these days to keep safe from COVID, but also the crucial things that one must keep at home? We would love to have a list of things that one must keep at home.
So it's one of the most essential these days is pulse oximeter.
Could you explain why that is important and how one must use that? Because people who've not been affected, completely are unaware that we must have an oximeter at home.
Yeah, because normal viral infection will give you symptoms, whether it is temperature, but it doesn't affect your lungs. But what happens is, the pulse oximeter gives you very early indication of involvement of lungs. So normal saturation of maintaining anybody from around 95, 96% is our normal saturation, or even higher, depending on who you are, what is your lung reserve and your conditions. But essentially, any level of less than 94%, you should get slightly worried and maybe ready to contact the doctor. But any saturation of less than 92% gives you enough indication that maybe there is lung involvement, and therefore early treatment and contact with the doctor is needed. Therefore, although you may not be feeling short of breath, but pulse oximeter can detect that such a low oxygen level in your body. Therefore, it is very, very essential to have pulse oximeter in every household.
So you would say that's the most important thing, and perhaps a thermometer, but nothing really other than, of course, your masks and everything, but an oximeter is something that one must invest in. And when should one rush to the hospital? Because that was one of the biggest problems, right? That a whole lot of people in India were rushing to hospitals, even though they were not serious or critical.
Yeah, I think that was noted. And it's not just one reading, which is important. It's a pattern we need to establish on the pulse oximeter readings.
So could you let us, help us go through that?
So as long as the readings are around 94% consistently, we don't need to worry. But any reading or pattern of readings less than 92% consistently, certainly doctor should be consulted by going to the hospital.
So how long would you say? So for example, if the oximeter gives me a reading of 92, for an hour, I don't need to worry?
Yeah, so 92, then you repeat your readings after an hour. So over a period of 4 or 5 hours, you have that window, 4 or 5 hours, and then you repeat your readings and then decide. But the most important thing is, when we are doing pulse oximetry, we need to do it properly. Number one, the contact with the device. Our hands, fingers should be warm. If they are cold, then the pulse oximeter will not detect proper reading and it will be falsely low reading. So those are the basic precautions. That is why one reading should not be taken as an absolute reading,
Seriously.
and there should be few readings over a period of couple of hours or 3 hours, and that gives us an idea.
And should we be seated? Should we be standing when we're taking the
Yes.
reading? Before food, after food?
I don't think it makes a big difference,
Okay.
as long as we are sitting in a comfortable position. And one of the things quite often some people do is to check their pulse oximeter after exercise, after walking
Yes.
for 5 minutes. So it tells you about your lung reserve. Because if your pulse oximeter at rest is 94, but after walking it is dropping down to below 90, then that's another indication that something is wrong and needs to be investigated.
Okay. Professor Parag, I'm so intrigued by the different rules where children are concerned globally, right? So children and their safety, and are they at a greater risk? Because you see, India's been very vigilant with schools. They've been shut for over a year now, while UK is keeping schools open. So is that a risk? Why are, countries making different decisions where children returning to schools are concerned?
So the good news within the UK is that despite opening of schools a couple of months ago,
Yeah.
we have not seen surge in the cases.
Okay.
I think in a way that links nicely with the vaccination UK is seeing. Now, India is facing a different problem at the moment because only 19 crores or 190 million have been vaccinated. So India probably will have to take a different view of closing the schools till such time that enough population is vaccinated or young parents are vaccinated. So children from the first strain were not affected, which is good news. But Indian strain appears to be infecting the children. So I think we need to be very, very careful with this Indian strain, which has come to UK, to see how it is going to affect, how it rolls out, what needs to happen. But because of the vaccination in the UK, I think in a way it gives us slight reassurance that yes, children probably, because after all, children are going to get it from adults. And if adults are vaccinated and if they're not getting the infection, unless this strain changes, mutates, and starts infecting children specifically, I think, but still, we need to be on guard. Children need to be on guard as well, as many precautions as possible in school. And yeah, it's a very difficult area because on one hand, you don't want to deprive them of their education.
Sure.
So it's a difficult area.
It's a tricky area to walk on, especially in the UK, I would feel. While in India, they just had this decision that, yes, we will be homeschooling. So, of course, that has its pros and cons as well, where children want to, meet up with their friends and go outdoors.
True.
So it's so important that, that children, especially, I would love to add here that, we're mindful about everything that they're missing out on. And we're more gentle and more kind with our children, because it's so interesting when they're just frustrated and upset, they sort of express themselves in very unique ways.
They have their own unique ways. Yes. Right.
Yes. Professor Parag, let's get back to talking about vaccines, the uptake and how to make it more accessible. But I also wanted to explore and ask you the reasons why some ethnic minorities are avoiding vaccines. There are a whole lot of people I talk to who just don't want to get vaccinated. So what could we tell them?
I mean, as we discussed, vaccination is the key if we want to overcome this challenge of pandemic. Now, we need to ramp up the production of vaccines across the world. And the good news is that US has proposed vaccine waiver, in which the so-called intellectual property of companies who have produced vaccine will be waived off. India is a leader anyway in terms of vaccine manufacturing, and India just needs to ramp up the production and delivery and door-to-door campaigning. In terms of myths, there are some myths around vaccination.
Yeah.
And whether it is, our personality will change, this is going to affect our DNA and our whole DNA structure will change. Some rumor is going on those lines. Then a myth that will we become infertile, after getting vaccinated. And then another rumor, which is specifically attributed to one ethnic group or really relevant to one ethnic group, is porcine gelatin, because the gelatin is a substance which is used to stabilize the vaccines. Now it is coming from pigs. So obviously, coming from a specific community, you don't want to take it. So certain individuals are very averse to the idea of having anything which is coming from pigs. So you can understand, but equally
sensitivities.
very sensitive. But I think this is the time when all public community leaders, religious leaders, and the government need to sing from the same hymn sheet and send a very clear message that, look, come what may, vaccine is the only answer to overcome this problem. And I think a lot of local people, a lot of villagers are influenced by the community leaders, by the local leaders, and by
That's
religious
true.
leaders. Therefore, it is very, very important for those leaders to be completely on board and help the government.
That's really important, and thank you for that. We're constantly getting a whole lot of questions from our viewers. There's one lady who's saying that if I do get the vaccine, how long before I try to get pregnant? So, what would you say to women who are not pregnant yet but have taken the vaccine and now want to have a baby?
That's a very interesting question. I never heard of that before, because nobody of the childbearing age was getting vaccinated at this time. So I think it remains to be seen the ideal duration after 2 doses of vaccination. Let's see. I'll have to search on that data.
Okay, great. So you could let us know, and then we could let all the ladies know who are, how sweet, planning a baby.
Yes.
A very intense question. Can we expect a third wave?
Yes, we should be prepared for the third wave, because this is a typical virus. It mutates quite rapidly. So there is every possibility of third wave. And I think everybody should be prepared for it. And therefore, all the more reason, once again, to prevent ourselves from getting infection by observing all the behaviors we have been observing for the last 6 months.
So Professor Parag, would you say that staying at home and social distancing is important even for groups who are not, at high risk? Because a whole lot of youngsters, teenagers, are out there and probably, could be passing on the infection. So it's really important even for people who are not at high risk.
Absolutely. Because those young people, they may get the infection, they may not get the severe infection, but they still get the infection. The high-risk people are getting severe infection. So I think the infection can be spread by young people. Therefore, it is important that people work from home as much as possible. People maintain that distancing. And I think that is going to be the new norm post-pandemic, unless we come to a situation where everybody is vaccinated and the so-called virus becomes an endemic and gradually this starts disappearing. But right now, we need to be very, very careful.
Now let's nosedive where telemedicine is concerned, because it is the future, as you said. So, let's elucidate more about telemedicine.
So I think in a way, pandemic has given us an opportunity to think outside the box. Something which people were talking about pre-pandemic suddenly have the courage now to practice it, which is virtual consultations, virtual ward rounds, and so on and so forth. So our project largely revolved around virtual ward rounds with junior doctors in India. So they were presenting cases based on their clinical parameters, based on their laboratory results. And we were making decisions, or we were recommending based on that observation. And that worked out quite well. Initially, there was some hesitancy. So now looking at that, this whole idea of telemedicine can be extrapolated to the wider world. And we started with the first hospital, Dr. Khandelwal, who was the managing director of the hospital. And he was very willing to embrace this idea and be brave enough to say, let's get on and have Indo-UK collaboration on telemedicine with the hospital. And I don't know, maybe we can hear him out.
Sure. So, would you?
Second wave के समय India में there is a huge surge of cases of COVID-19, and more particularly it was more in this part of the country where the number of cases have gone up in a very short span of time. And because it has happened in a short span of time, there was a lot of unpreparedness. And to fulfill this, it took some time. And in this kind of a situation, BAPIO, that is British Association of Physicians of Indian Origin, UK, the doctors came to us as a big rescue. They have given us the telemedicine support. Now, what is that? They have taken the virtual round. Our RMO used to take a virtual round with them on video, And because of that, our senior consultant gets some time to spare for the other patients. The second thing which came is a telemedicine consultation. In the cases where our consultant need to have discussion with our counterpart at UK, it has happened very smoothly, very properly, and it was very nicely done. So a big thanks to Dr. Parag Singhal and his team who came to us at a time when we were needing a lot. Thanks to them and his team. And same as the support we got from the radiologist team. We used to do HRCT, which was ranging in the range of 250 to 300 cases per day, and sending them for reporting at UK to our colleague was a very handy thing. And they reported the thing for us immediately, and because of that, we could finish up the reporting of the cases within the stipulated time, and that has helped us in management of the patient in a very quick time. So that is really speaking, BAPIO has really helped us in providing all this support, virtual round, telemedicine consultation, and teleradiology. This was a big thing which is happening, which is there, which we are using almost since a month, and it is really, really a great help to us.
That's really wonderful that you want to give back to your country. How can other cities get in touch with BAPIO, and how can NRIs contribute to BAPIO so that you can continue doing the amazing work that you are?
Well, thank you. Yeah, so a lot of hospitals are expressing their interest to join this program and take advantage of this program. Right now, because of the lockdown, the activity has come down. But we are already linking with one hospital in Gujarat, hospital in Manipal, hospital in AIIMS Rishikesh. And what we want to do is to expand this whole idea in the setting of India. And this telemedicine is so relevant in Indian setting. And I must come in here and applaud the Universal Health Scheme launched by Honorable Prime Minister of India, Mr. Modi. Ayushman Bharat is a
It's
a fantastic scheme. But what we need is manpower to implement that scheme. Now, the reality is that doctors after graduation, after having done post-graduation, don't want to go to villages and be settled there. So we need to come up with something, a different mechanism. Equally, the villagers find it difficult to travel 50 kilometers or 20 kilometers to a hospital which will offer them support. So what we need to create is a system whereby we can offer them health advice through telemedicine locally. So we want to make health accessible to them locally through telemedicine. And the reason I'm saying that is that 80% of diseases can be managed in this way. 80%. Of course, there are some diseases which need to be admitted to hospital, which need to be, dealt in different way. Now, if we can create a system whereby we have hub and spoke model, that hub is in the center of the district and spokes are in different villages or primary health centers, then the doctors, instead of going to villages, are actually sitting in the hub, offering advice, linking with the health worker in the village and getting some basic bloods done. So suddenly, what happens as a result of this is that masses will start getting the health care rather than having to travel. And this is how we can create this telemedicine hub.
Lovely. So it's just the health centers in rural India will benefit with telemedicine, and that can offer early advice and monitor the disease.
Yes.
That's wonderful. Should we have a look at Sanjay Agarwalji's video, right, to tell us more about this?
The PhD Chamber of Commerce and Industry of India and Dr. Parag Singhal of BAPIO have been in discussion for the past many months on ways to utilize telemedicine as a method of collaboration between our two nations. The surge of COVID-19, the second wave that has come about in our country, has made us take immediate steps now to work together to provide telemedicine solutions to the Indian hospitals, which are currently facing shortages of medical manpower due to the very high number of patients. I sincerely believe that not only will this great offer of help from the Indian physicians, members of BAPIO, be of great use and prove a life-saving effort for a large number of patients in India, but shall also help in sharing of best practices and of various treatment protocols between the two nations that will help the fight against the scourge of COVID-19, which is fast developing and fast changing. Thank you.
So, Professor Parag, will this be the long-term solution, not just for India, but globally too? Telemedicine, and will it really help COVID for sure, but various other illnesses?
Absolutely. I think that's the future of medicine, in my opinion. And if you look at worldwide, despite US spending 17% of GDP on health, UK spending 9%, and European countries spending 11-12%, all health systems across the world are under tremendous strain financially. And I think our drive has to be to reduce the cost of healthcare.
Yes.
It's not about how much we spend, it is about how we spend the money. And telemedicine offers a very cost-effective way to deliver medicine at a much reduced cost while maintaining the same quality. And this is what is needed. I mean, just imagine anybody who requires admission for a simple thing, the cost goes up in the hospital. But if the same thing can be delivered through this telemedicine hub consultation, linking with the health worker who can supply antibiotics, suddenly the cost to the patient comes down, and cost to the state comes down, and cost to the private insurance also comes down. And I think that should be our drive worldwide, to reduce the cost, promote accessible healthcare, and reduce the health inequalities which exist in the society.
That's exciting. Let's also have a look at, the amazing international coverage where BAPIO is concerned. BBC, Sky, Channel 4 have, beautifully elucidated the amazing work that you're doing in India. So let's have a look at that.
Their loved ones thousands of miles away. Professor Parag Singhal represents the British Association of Physicians of Indian Origin, which is raising money for supplies to help the aid effort. And he joins me now. Good morning to you. Must be an awful time for you. It's distressing for all of us seeing the pictures and the information coming out of India. What have you been able to glean about the real situation on the ground?
I think the situation is very grim, and we hear on a daily basis quite horrible stories and horrific stories. So on behalf of British Association of Physicians of Indian Origin, we are trying to do as much as we can.
Good evening. Doctors based here in the West are helping save lives in India as COVID continues to ravage the country. They're using their experience in treating the virus to give advice over video calls to medics in some of India's hospitals. How is India?
It's looking grim here.
Sat in a conservatory in a leafy suburb of Western Supermare is Professor Parag Singhal, an expert on COVID who works at Western General Hospital. He's hooked up on a video call with Dr. Shaili Chandak, who's half a world away at a hospital in Nagpur in India.
Obviously, we can't be there physically because of all the various restrictions. But because of technology, we can at least provide our expert input and do as much help as possible remotely.
What does it mean to you, the support that British Indian doctors are giving to you?
Good and a great help to us.
Dr. Archana Samani works at this hospital in Nagpur. Every single bed on this ward is being used for COVID patients. Many lie desperately ill.
I think every doctor here felt compelled to do something to help India.
Professor Parag Singhal says thousands of NHS doctors have links to India and have been affected by the crisis there.
So do you want to describe the patient's background and the condition?
He and his colleagues from the British Physicians of Indian Origin, or BAPIO, have been holding remote consultations to support Indian clinicians like Dr. Samani.
It's not that they need expertise of UK doctors, they have enough expertise, but the doctors are there rushed off their feet.
The professor was moved to help after a friend in Delhi spent all night driving from hospital to hospital, but couldn't find a bed for his uncle.
And of course the sad news was that he had passed away. And it is, I was speechless. I was speechless for a couple of minutes. I don't know what to say. I didn't know what to say.
And I was reflecting, here am I, and people are so helpless, and I'm helpless as well. There's not a lot I can do, and it affects you.
Practical support and prayers from communities who fear that this crisis still has many, many weeks to go.
Oh, this is so emotional. It's such a surge of emotions. I've lost my father to COVID, but even then, that pain sort of pales in comparison with what we're going through globally. So, at this point, thank you to you, all the doctors globally who are doing such remarkable work. So, as a video beautifully said, that it's practical support, it's empathy, it's compassion, and love and togetherness. That sort of has to be the foundation where this pandemic is concerned. Professor Parag, thank you so much for your valuable time and the exemplary work that you do both for UK and India. And thank you to BAPIO UK. I would like to thank our director, Amish Tripathi, for hosting us. A big thank you to our team at Nehru Center, Brij Guhari ji, Archana. Gratitude to our tech genius, who makes our virtual events such a breeze, Vinny Jory ji. Thank you to the Indian High Commission UK. And last but not the least, our wonderful viewers, sending our thoughts, prayers, and warm wishes to each of you. Thank you for joining us. Thank you for streaming in. Stay well, stay safe, and see you soon for another mind-expanding event at Nehru Center, UK's cultural hub. Last words from you, Professor Parag.
No, I think I just want to thank everyone, and thank you to you, Rageshwari ji, and to Nehru Center and Indian High Commission, and what we have been very blessed with the support from Indian High Commission in setting up educational programs, and those educational programs are effectively to train doctors in India and then bring them over to UK. So our programs are meant to help India, to help UK, and to help the trainees. So that obviously is much needed support from Indian High Commission. So thank you to all those people who are involved in those prestigious projects. And no, I just wanted to thank, and maybe Dr. Bamra would like to thank everyone.
Absolutely. Of course, we're going to have a look at Dr. Bamra's video. Huge gratitude.
The BAPIO COVID India appeal, launched in the wake of the second wave of the pandemic in India, which has caused so much misery, was really our way of trying to support our friends, colleagues and family over in India. And it could not have been possible to do this without the huge amount of effort that BAPIO officers have put into this. But also I want to thank our BAPIO members, the public, the general public, British public particularly, who've donated generously to our funds. And also I want to thank our partners, DAUK, Akshapatra, Apna NHS, the BMA. All of these have helped us to put a package together in support. I want to thank everyone from the bottom of my heart.
How lovely. Thank you once again, Professor Parag. Thank you for your time.
Thank you, Rageshwari ji, for spreading our message. What we are trying to do is just not even drop in the ocean, but certainly we will continue our efforts to help as much as we can. But no, thank you for your help in spreading the message.
Well, each drop creates an ocean. Thank you, everybody, for tuning in. Namaste, Assalamu alaikum. Stay well, stay safe. Much love, and see you next time on another event at Nehru Center. Thank you.
Thank you. Thank you. Thank you.